Good morning. It's hard to fathom 1 million American lives lost to COVID-19. That's a grim milestone, and it happened late last week and throughout the weekend. And historians help put that number into context. 1 million deaths from COVID surpasses the estimated 675,000 deaths from the 1918 Spanish flu. More people have died from COVID during a 2-year period than from vehicle crashes over the past 2 decades. And more Americans have now died from COVID-19 than on all of the battlefields in all of the country's wars combined. It's a stunning number. So many families touched by the virus. So many families each day marking anniversaries, birthdays, and holidays without a loved one who was lost to the pandemic. There is no getting back to normal for these families. In St. Louis County, 3,341 lives have been lost to COVID-19. And thankfully, COVID is no longer sending people to the hospital in record numbers. However, the number of cases in our community has been steadily rising. And health experts have raised a caution flag. The Department of Public Health has been warning us for weeks that the number of new COVID-19 cases in St. Louis County is on the rise. In the most recent count from Friday, we are averaging 273 new cases of COVID every day, and that figure represents a 30% increase from the same number the week before. Because of this increase, St. Louis County on Friday moved up the CDC's measurement of community risk for COVID from low to medium risk. So far, this increase in cases has not led to a corresponding rise in the number of people being hospitalized. However, we continue to monitor COVID hospitalizations because we know that the higher number of cases, the more likely it is that some of those individuals will end up in a hospital. So what does this mean for St. Louis County? First, it means that your risk of contracting COVID-19 is higher than it was just a week ago, and substantially higher than it was a month ago. There are some who think getting COVID is no big deal. After all, many people who contract the disease only get mild symptoms, or no symptoms at all. But consider some people, especially those who are older or who have suppressed immune systems, are vulnerable and may experience severe symptoms. If you're in contact with anyone in these categories, you may expose them to a disease that could make them very sick. And don't forget that children under age 5 cannot currently get the vaccine, meaning they are vulnerable too. Some COVID patients experience what is known as long COVID. We're still learning about the health impact of long COVID, but we do know that some individuals have lingering symptoms that can last for several months. So what can we do at this point? If you still have not gotten vaccinated, please do so. Vaccines are safe and incredibly effective at preventing serious illness and death. If you're 50 or older and it's been several months since you got your booster shot, getting a second booster can turbocharge your defense system. Talk with your doctor about when getting the second booster is right for you. If you feel sick, get tested right away. We now have very effective treatments for COVID, but they're only effective if started within 5 to 7 days of contracting the first symptoms. Talk to your doctor about treatment. It's been wonderful to see proud parents posting photos of their kids graduating, robes, mortarboards, and smiling faces. With more people vaccinated and more effective treatments available, more and more people feel comfortable gathering, most without masks. But some people are not quite ready to go to an indoor public place without one, and that's fine. In fact, we recommend wearing a mask if you're high risk or if you live with someone who is. And here is how St. Louis County can help keep our residents safe as we see this uptick in cases. We offer free drive-through testing at our 3 health department clinics in Jennings, Berkeley, and Sunset Hills. No appointments are necessary. We also provide free, safe COVID-19 vaccinations and booster shots at these 3 clinics. No appointments are needed for those either. It's great that COVID is no longer dominating the conversation, and it's encouraging to see our businesses filling up with customers, and the confidence of getting out and about is growing. But there are times like today when we must pause and provide an update on the virus, especially when the number of cases are climbing steadily. This is not a cause for alarm. rather a reminder that COVID is still very much among us and there are ways to help prevent catching it, spreading it, and getting very sick from it. Thanks, and I'm happy to take any questions.
Do you see the county bringing back any mask mandates in the future?
Oh, I think we're a long ways away from restrictions. We're at the point now, like the rest of the country, where our conversation isn't about mandates. It's about how we can live with the virus, about vaccinations, about being thoughtful, about getting tested, especially if you're sick, about taking some extra precautions if you're around folks that are more vulnerable, people who are immunocompromised or older or at higher risk. This is about recognizing that the case numbers are climbing and we need to be thoughtful and use the tools we have to keep the virus from spreading more in our community. Any other questions? Okay, thank you.